the live demo scan sessions for RSNA 2020. Our theme for RSNA 2020 is intelligently efficient. We'd like to highlight this through a series of these live demonstrations that we'll be hosting throughout the week. Two from our global headquarters here in Waukesha, Wisconsin, but then also another one from our headquarters in Luke, France. These demonstrations will span across both 1.5T and 3 Hey, you're on the SIGNA Voyager.
Yes, and we are happy to show you today on the SIGNA Voyager that we finally launched also the air technology and the air coils there. So what our plan is for the scanning session this morning is we will do our volunteer covered with the head coil and also with the air AA coil on his body and pelvis. And you can see the easy workflow and free breathing techniques we can offer on the SIGNA Voyager. But first, we just want to highlight and show you the coil before we put it on our volunteer. So here is the air coil. I think we have to just relaunch the meeting here that we can show that the image is not frozen, or we just switch the camera angle once and check that again. Okay, I just relaunched that.
Apologies, we have a little bit of a technical issue here with the bandwidth.
But hopefully now you can see the air coil when we hold it into the camera. So this is the air coil launched for the Voyager, and you can see it has the same flexibility as other air coils already have been launched on the 3T portfolio on an artist. And what we are going to do with this air coil is we will put it on our volunteer and start scanning for the brain, and then we will continue switching to other body parts as well. So now you can see our volunteer from the up camera. So what we will do is we will position him in the head coil as well. And as you know, the air coils don't follow any rules regarding overlap. So I'm not really worried about the overlap to the head coil. So I can position the air AA coil on top of his body and just making sure that I cover everything regarding the neck and his pelvis. You see that we have the entire body covered here from his head until his pelvis without not moving the coil at all. And then the other advantage really of having the air coils is that we don't have to strap the coils on the patient. So you can just leave it loose on his body, and since it's designed as a blanket, the coil is just really moving along with his body nicely and gives a lot of signal also on the body parts which usually don't get covered with coils that easy. Okay, so now I think we can just go ahead and start. And we will continue scanning outside. The switch? So now you see the user interface, and we just step outside of the magnet room and start scanning. The patient data's information is already loaded into the scanner. I've picked the protocol, and then I can just go ahead and start the exam. So we will start, as I said, quickly with the brain to just show you the capabilities of combining multiple coils together, and we don't have to worry about like picking the right coil, because we have something now in the scanner which we call air touch, which helps us with the coil pick as well. So here on the user interface on the right-hand side, you can see that we combined the head coil, the air coil, and then also the PA coil in the table. And I will just go ahead and start with the localizer for the brain here real quick. Air touch is a new technology for the coil recognition technique, and what it does create every single time before we do a localizer sensitivity map. And here in the upper right corner, you see that there was a scan generated, took only 2 seconds. And in that 2 seconds, we are creating that sensitivity map. So what we do is we turn on every single element of the scanner itself, and we have all the coil elements active in that field of view. So after the localizer is done, we know exactly which coil elements are where on the patient, and then the system will just make sure that it always picks the right elements to maintain the best signal. So we do start here with the brain exam. We will just show you T2 propeller scan. This scan is only 2 minutes with an implant resolution of 0.6 by 0.6. And also what we see is that I don't have to prescribe any slices. So we were talking about our intelligence and efficient scanner, and the first deep learning technique which we implemented on all of our scanners is the slice prescription for brain, which we call RX.
Yeah. So it's a nice feature to be able to have the freedom and flexibility to move and span across multiple coils. AirTouch providing that capability and really taking advantage of having a lot of versatility while you scan, because you might end up having to move around during your scan. You could be doing pelvis, abdomen, spine, and scanning also with the head unit on the table always. If you're doing abdominal imaging, can really improve your workflow and productivity by not having to take the coil off each time.
Correct. And now, as we just said, we just will continue scanning directly after the first scan in the liver. So I just run a localizer, and he's a little bit larger volunteer, so maybe I will go all the way down here. So you see that the localizer will just now do another scan in the liver, and then we will just continue scanning in the liver and show you all our capabilities of 3 breathing sequences in the abdomen. Maybe 2 more words regarding RX, which is our slice prescription technique. I showed you that the slice has been prescribed in the brain automatically, and it did that because here on the user interface, we can pick which slice prescription should be done on that sequence. You can see that we have different landmarks available for the brain, not only the ACPC line or the OM line, also slice prescription for the temporal lobe, the inner ear, the orbits, the optic nerve, the pituitary, and the circle of Willis are available. And that was our first deep learning really on the scanner, because this model has been trained on 36,000 localizers, and makes sure that no matter how the coil, the head is in that coil, meaning like if you're scanning a patient with a stroke and the head is tilted to one side, this algorithm is always smart enough to detect these landmarks and make sure that the slice prescription is done always in the same way. So actually, it's no matter if I'm scanning or Steve is scanning or you would scan, the slice prescription is done always in the same way. And that helps really a lot when looking at the images later for the doctors, that they always look at the same slice prescription.
Dad's got to try to work a little bit.
Okay, so now we have our first images done, and we can start already looking at them. I will launch our post-processing tool here on the scanner. So here is the first images we just generated. You can see how nicely and even the ACPC line is fit here.
Hold your breath.
And it's all done in 2 minutes and 7 seconds.
also with Propeller, right? So then you're able to eliminate a lot of physiologic motion, or even gross patient motion from CSF flow, carotid pulsing, or anything like that can all be eliminated with using Propeller.
That's right. So now we arrived in the abdomen, and as you can see, the localizer is done, and AirTouch did a great job in order to find the coils. So I will just maybe hide the slices that you can better look through it. And I will remove the shim here in a bit so that we can really look at the slice description here. So what you see here on the sagittal plane is most obvious is the lines for the PA coil. Here's part of the HNU, here's part of the anterior part of the HNU, and here's the RAA which we placed on top of his abdomen. And you can see that AirTouch does exactly know where my field of view is, and I can move it all the way, and AirTouch does always do a right job in order to turn on the coil elements needed to make really a good image quality here. So then we will perform another propeller technique. So propeller again is motion correction. And then on top of the propeller technique, we will also use our navigator, which is our free breathing technique. So here you can see that the navigator has been placed without my interaction. That is really a nice feature too. Whenever the localizer is done, I added a post-processing task, and the system is able to find where the diaphragm is, and will just prescribe the navigator there. And in order to save some scan time, I will make sure that I really reduce my face strap here, and then we can start scanning. So what we do in the first sequence is we combine two methods together. We use our motion correction propeller on top of the navigator to really let the patient entirely breathe as he wants, and we can generate nice T2 weighted images and not worry about him breathing in a certain way.
So this display shows us the diaphragm of the liver, placement of the tracker. So at in expiration, each time it's triggering at end expiration, and you can see that. I'm sorry. You can see that with the red line there. This is the threshold that we've established here for end expiration. The nice thing is we could adjust this on the fly. So sometimes patients tend to relax during the scan. You can adjust this threshold lower based on the respiration without having to end the scan and start over. And then you have an acceptance window here too. So you can adjust these yellow lines on either side of the red line by narrowing this down a little more if you needed to.
Yeah. And I will show you here on the slide really, when you look at the threshold, the red line, when I click here on the arrow down, then you can see that the red line also goes down. So I really like that feature a lot because to be honest, every patient for abdomen scanning is on your table and is really nervous, so they're breathing fairly fast. And then after a scan time of 1 or 2 minutes, they understand that MRI is not the worst they ever had in their life, so they tend to relax and calm down, and the breathing pattern totally changed. So when we didn't have that feature of like interacting with that software, what would happen is that the scan would stop, and you always have to resume, have to talk to your patient to breathe in a certain way to make that scan happen. Now, having that capability that we can interact with that all the time, then I don't have to worry about changing the breathing pattern. So that really helps a lot during our daily routine to make free breathing scans happen. Okay, and then we will do use the same feature here for a diffusion sequence. As you can see, tracker has been placed again automatically. So I will find the spot in the liver where it is positioned, and we see it's done again perfectly. And then I will just prescribe some slices for a diffusion image here in the liver, also in free breathing. The diffusion I will acquire with different B values. The first one I will acquire with a B value of 50, then I will go with the 700 B value. You see that we have the capability of doing different averages per the different B values. So I always make sure that I will have a good signal for the higher B values and be fast for the lower B values. And then on top of it, I will also show you that we can synthesize B values here as well. So every single time when I acquire two B values, I'm able to synthesize a higher B value, and that is a feature we call magic diffusion. And again, all combined with our free breathing technique with Navigator. So actually, all of our contrasts are able to be combined with the Navigator. So that's really nice that I don't have to worry about some of the contrasts not being able to do in free breathing. Now with the Navigator, I'm able to do the T2 contrast, the MRCPs, the diffusion, which is not a big deal, but thinking about T1 contrast, which is always like the ones which are having short TRs and TEs, which was challenging prior, I'm also now capable to do a free breathing on our T1 sequences. And we let the diffusion run, and I will go ahead and show you the propeller sequence we just acquired here. Split the layout, and then we can go ahead and go with the propeller sequence. Okay, just go and check real quick here. Okay. So here is the propeller on the right-hand side. You see the fat suppression is good. I zoom in a little bit more that you can see the details a little bit better. All done, as we said, in free breathing. Our volunteers haven't been prepped, obviously, so we are not in control if they had breakfast or not, but here his stomach looked fairly empty, right?
So maybe you didn't have breakfast.
So this scan was done in 3 minutes. We covered the entire liver, and as we said, it was all done in free breathing. So now we are doing the diffusion sequence here, and then I want to show you that we are also capable of doing T1 sequence with the Navigator. So again, we place the out tracker as you see here. So I will scroll through the images to show you that the tracker has been placed again automatically. And then what we will do is just do our T1 sequence, radiant echo based, which we call lava here, also in free breathing. We use lava flex, and that means we will do a Dixon technique in the background. And here you see on the user interface that the in phase and the post phase will be shown up here as well. And again, that is a T1 sequence, which we can also do in free breathing. So thinking about dynamic scan or like an arterial phase, you're able to do that all in free breathing, which I think is huge, thinking about your elderly patients coming into, and they are not capable of holding their breath for like 20 or 30 seconds. So that is why it's really nice to have now every single contrast available in combination with a Navigator. Okay. Then I just want to show you something in order to really show how easy it is to work with our new coil recognition technique. And I will just use that sequence here and pick a really less S to I coverage. So when we go ahead and remove the shim, and you just see here a small S to I coverage, you see no matter where I go into his body, AirTouch is following me and is always selecting the right coils to make sure that we have the best image quality. So as a technologist, that's really for me a nice feature, because it happened to me multiple times in my 20-year MRI experience that I scanned somewhere in the body and I forgot to turn off the right coils.
Yeah.
So now I just have to make sure that I highlighted the coils here, and all the coils I've plugged in can be just like selected. And then the system will do the work for me and just pick the right coil elements, so I don't have to worry about that at all.
Definitely simplified a lot of things. Before there was a long list of coil selections or configurations that were in the list, and now just simply with the icon, that's all you have to do, yeah.
So now we can look at our diffusion images. Here is the B50 value, as you can see, and we will just scroll here through so that you can appreciate how less distortion we have in these images. All done again, like as I said, in free breathing. And then we want to show you also the higher B value, which is the most challenging. And then you can see how nicely here also for the high B value you have all the signal. When we started doing diffusion and abdomen, I remember these times where I never understood why these images are so important, because there was so much distortion and so much less signal in the images. But now, as you can see, it really makes sense to do diffusion and the abdomen, and have that done also all in free breathing is really a nice capability. Okay, now that the free breathing sequence for the lava flex is running, and I will run a coronal single shot. This single shot will be breath hold. I just want to show you something fast, what is really the advantage also from the air coils. So we do have acceleration techniques on the scanner, which we call ARC, and the first one will be accelerated just by a factor of 2. But I want to show you the same slice orientation and the same sequence, and I want to show you that with the air coils we are able to accelerate higher. So in that case, I will do the second scan with an acceleration of 3, and we want to compare them afterwards. So you see that the acceleration factor will save me 3 seconds of a breath hold. So that means that the patient comfort is way better, given that we can scan way faster. But I will show you when we review the images that we don't lose any signal because we have so many elements in the field of view.
A nice thing about accelerating fast with single shots as well is the images get a bit sharper. So they'll look, the edge detail should be a bit better with higher pill imaging factors too.
And then to just close out our session, I will just run a quick sequence in the pelvis. And here we can just go ahead and now look at the images. So this was the free breathing sequence we did for the liver. So T1 contrast in free breathing and Dixon technique.
Relax.
That's really nice when you think about having already so much signal without using contrast media. I think you can imagine how much more signal you will get when we would have contrast media here available as well. And then we can go ahead and show you the comparison between the different acceleration techniques. So on the left-hand side is the acceleration technique by 2. On the right-hand side is by 3. Here you can see the scan time is 12 seconds for one breath hold. Here it reduces to 9 seconds. And when we look at the details, you see that when we zoom in a little bit more, that nothing really get lost by accelerating higher. And that is really where I see a huge advantage of having air coils available on that scanner, because we can just be fast without losing any signal.
Look at the coverage from the dome of the liver all the way to the pelvis, right? So that extended Z coverage is pretty fantastic, actually. Gives you a lot of flexibility in how you would scan. If you need to do a pelvis exam and then go to the liver, for oncology purposes or anything like that, it's quite capable of doing that.
And now we closed out our session with the propeller sequence for the prostate. So we will have a 3 millimeter slice thickness here. The scan will be 3 minutes. And look, we still have plenty of coverage here with the air coils. You see that the coil extents still are available, so I don't have to reposition my patient. I can just end up with a prostate scanning with not touching the patient, not doing another landmark. Which is really huge, thinking about that we are able and capable of scanning the head first and end up in the prostate with never doing an additional landmark and never doing any other setup on the patient. Okay, so this scan is also 3 more minutes, and I will want to show you one more thing while this is running. Since we did the Dixon technique in the abdomen, I want to show you that we have all the 4 image contrasts available. So that is what we did all in one session and all in free breathing. So Dixon gives you the water selective image, the fat selective image, the in-phase image, and the post-phase image. And we did all in free breathing.
If there are any questions in the chat, please feel free to ask. Be glad to.
Steve, I don't see any questions in the chat yet, so everyone feel free to enter them in the chat or go ahead and ask live.
Yeah, I think maybe just to resume what we did here today, the huge advantage of now having all these capabilities like air touch and the air coils also on the Voyager is really that I now can set up the patient like with multiple coils, not worrying about like where I want to start with the scan, where do I want to end with the scan. I can just set them up and the system will help me to find the right coil elements. The other huge advantage is that we can do free breathing with any contrast, and also that for the patient setup is so much easier because as you saw, I didn't have to use bellows on the patient. I don't have to worry about where to put him on the table. It works everywhere. I just have to run a localizer and then the system will find the tracker position, which is really, really nice. And the air coils makes it also really comfortable for the patient since the coil design is light and it really feels like a blanket. So if your patient has an ascites and has pain, we don't have to worry about that at all. So it's really nice.
Yeah, there's a lot of versatility with the air coils too. Being a lightweight coil, you can position quite easily. One of the later sessions we'll do this week is, or I think actually later today, we're going to show wrapping the air coil around for long bone imaging, for musculoskeletal imaging. It's quite capable of doing that as well. So there's a lot of versatility itself with these air coils.
Okay, 20 more seconds and then we can look at the last images on the prostate. So if you have questions, feel free.
So this scan also was done with Propeller. So a nice advantage there is sometimes peristalsis motion can cause the images to be a little bit blurry. With Propeller, it should help take care of that as well.
Allow these images here, or maybe here in the corner. So the image is ready. And you see, prostate images are done with a small field of view, slice thickness 3 millimeters. And the nice thing is we don't have to reposition and do another landmark. It's all done when starting in the brain and ending up in the prostate.
Great results.
Okay.
All right, thank you guys. As we mentioned, these live scanning demonstrations will be performed throughout the week to highlight intelligently efficient. We hope that you guys will join later today. Particularly, there's another one with the air coil on the SIGNA Voyager, but we'll be doing them, as we mentioned, across the 3T and 1.5T portfolio.
Thanks for your interest.
Thank you.
Bye.